Welcome back. It's National Nurses Week. Dustin Hanscom is the clinical manager in Bangor for Northern Light Home Care and Hospice. Thank you so much for coming in.
Thank you.
You offer two services through you and your team. First, let's start talking about what home care is. Can you explain that to me?
Yes, home care is when a patient has been hospitalized or had a procedure and may need home health, nursing, or therapies to get them back on their feet. We take care of patients of all ages in their own environments to make sure that they can do their day-to-day living. There are studies have shown that if a patient is on home health, the reduction of ER visits as well as emergency visits have gone down.
The other service you provide would be hospice care. Can you explain to me what is hospice care and when should you seek it out?
Hospice care, the misconception of hospice care is that it's the end of days. We would prefer to get in there before then. We have many nurses, doctors, and social workers that work in conjunction with the patient to make sure that they are taken care of at their end of days, as well as put a plan and goals together for them.
Now, how do you get a referral to hospice care?
They would have to see a doctor, and the doctor would certify that the patient has 6 months or less, and then we'd get a referral for that.
What makes a hospice nurse's role different?
So hospice are really developed on quality and comfort. They're built on companionship with that patient as well as the family. They want to make sure that that patient and family are set and their goals are met, and they can work together to keep the quality of life at the end of time.
What drew you to this kind of work?
I have a lifelong passion with nursing, as well as challenges. I think this is a very good challenge, nursing is. Nursing has always been a challenge to me as a puzzle. And each patient is a certain circumstances in a puzzle pieces. So putting those puzzles together is always a challenge.
What would you say to somebody out there watching right now during this National Nurses Week who might be interested or want to know more about the profession?
So home health has evolved over time. We don't just go in and see patients anymore and just check on them. We go in, see patients. We may see an easy patient as a total knee and then turn around and go see a patient that has really high comorbidities as in a high hospital risk. So you might get patients that are very low skill levels to very high skill levels. And in this job, the skill level, the skills that we do, you may never do in a hospital because they have skilled clinicians there that do that for you.
Yeah, just never know what one day might bring to the next, right? All right, if you want to learn more about home care and hospice, you can go to northernlighthealth.org/HC@home. That's HC@home, northernlighthealth.org. Dustin, thank you so much for coming in, spend some time with us.
Thank you.